the Ghana Registered Nurses and Midwives Association, we know that your work as nurses and midwives is one that we can never overemphasize, and we can't also play with at all. This strike, won't our nurses and midwives reconsider it for the benefit of patients?
Yes, thank you. We are ready to reconsider this strike action only when government is also ready to reconsider its stance at the moment. It looks like government is not willing to demonstrate commitment to attending to our issues, and that is the reason why we are here. I must say that what we are doing is a reaction. There was an action and we are reacting to the action. We were expecting that from January to this time, this condition would have been implemented. But the action of government not to implement it is what we are reacting to. And so if government takes action to implement or to sign the document, then we can also withdraw our action and go back to work.
Tell us what you are requesting from government.
Oh, basically, all we are requesting is actually a basic, because we cannot cook a food that we are hungry but we cannot eat. We are requesting for medical care for all nurses in Ghana. Is it not interesting to see a nurse who is caring for the general public to be sick and then come to your office as a union leader that, look, I am sick, they have requested for lab, but I do not have money to pay for the lab. What can you do to help me? If your member is coming to you, a member who is providing health care is coming to you to say that I don't have money to pay for the laboratory test, how will you feel? So that is one. We also want a 13th month salary after working for a whole year. Could you imagine that in a facility where we provide services, facility is able to pay 13th month salary, which is coming from internally generated funds. Facility is able to pay that to all other staff except nurses, all because we do not have this condition of service. Is it not pathetic for all of us to work for the whole year? And facilities would deem it necessary or okay to use part of the internally generated fund to pay other 13th month salary and leave nurses. Is it not pathetic? The next thing we also want is our PIN renewal. We are aware that the facilities also need our valid PINs for national health insurance, for health validation and all that. We are only asking that government assist us with the renewal of our PINs. We are also asking government to also give us a small allowance for our uniform. We are supposed to dress in uniform anytime we appear at post. We are asking government to just assist us with our uniform allowance. These are basic things we are asking from government. And it is worthy of note that all these things were already signed. They were signed for on behalf of government of Ghana in May last year. We are only asking for implementation. We are not negotiating.
When you
we are only asking for implementation.
Prosper, when you signed in May, what was the timeline given for the implementation to happen?
Well, we didn't give a specific timeline. We approached the new government that, look, this is the agreement we've had with the previous government. And I'm sure they were all aware because we are all in this country. The directors at the Ministry of Health are out there, and so they are aware. So January we approached them that this is the agreement we have. For some reason, because of court issues, it was not implemented last year. Now it is set for implementation. We have met Ministry of Health 5 different occasions. The question is, what have we been discussing over the period? If government is committed, ready to commit to implementing these conditions, I don't think we'll be here. So from January to this time, it's enough time for government to implement these conditions.
Prosper, you were invited to a meeting by the National Labour Commission. The ministry was there, other groups other stakeholders were there, but the Ghana Registered Nurses and Midwives Association did not show up. If a commission like the Labour Commission calls you, why would you decide not to go?
Please, I think you need to confirm whether this invitation is really served to the association. To the best of my knowledge, we have not received this invitation, and so we were not able to attend.
The Labour Commission says that your strike is illegal and they are asking you to return to the hospitals.
Yes, I think before we get to that level, the question is it also legal for a signed document to be hanging on the table? That is the question. This document in front of me here is being signed on behalf of Government of Ghana by Honorable Benjamin Atta, and again by Honorable Ahaji Hafiz Adam. This is a signed document on the 20th of May 2024. Is it legal to keep this on the table till now? The whole issue is that we need to look at the poorness. Okay? This poorness who is struggling from Dodowa to Kolebu, okay, to take care of people they don't know. You see, because we try to care for the general public, we take care of that sick person who has defecated on himself, okay, and go back home. Then at the end of the day, you are telling us that we do not have the condition, and so we cannot take some 13th month salary that you're paying other workers. You cannot pay for our uniform allowance. You cannot pay for our medical care, the care we are providing. We have to look for money to pay. That is what the general public should be looking at. Okay? Yes, they are saying it's illegal, but the question is it also legal for government to sign this with us and then keep it on the table? How long are we going to wait?
Well, so we understand by your roadmap that by Monday, if you have not, your requests have not been implemented, you would proceed on a full strike.
Yes, that is true.
Okay.
That is true.
Well, the ministry had given us some guidelines. Let me read it to you, and then I'll come back to what the Ghana Midwives and Nurses Association also said. The ministry had mentioned that rotational nurses and nurses who are currently undergoing mandatory clinicals are advised to refrain from any industrial action. The Ghana Registered Nurses and Midwives Association also came and virtually told the rotational nurses and those who are currently undergoing mandatory clinicals not to give any services because they work under supervision. They do not work independently. If the ministry in its own way is also finding ways of mitigating the issue, why are you blocking why are you blocking their mitigation efforts?
I don't think we are doing that. You read that these rotation nurses are supposed to work under supervision. Okay? And so if these rotation nurses decide to go, it's over to them. But again, it's important to also note that these rotation nurses are even complaining about their salaries that has not been paid, their allowances that have not been paid. Some have not even received clearance. Okay, so for us, we think that it is just fair to address the whole issue at this moment. But if government decides to hold on to all these tactics, well, we leave it to rotation nurses to decide whether they will really go or not. Thank you.
Oh, but we understand that in the nursing fraternity or in the nursing family, you really work with seniority. And so if you say that it is up to them, what do you mean by that?
Well, what I'm trying to say is that the rotation nurses are also having a union on their own. And I have seen their letters advising members to refrain from this directive. But of course, I also know that they have the individual wishes and plans So some may wish to go. But left to us as professional nurses, these people are not qualified to practice on their own. And we know that allowing them to practice on their own, we are putting the general public at risk because we cannot guarantee the service, the care they are receiving. These people, rotation nurses, are actually learning. So if you want a learner to take care of you, it's a problem.
When you look at the Ministry of Health plan, the plan that they put in effect to minimize the effect that your strike may have on the entire health service delivery, do you see it as fair?
It is not fair. The only thing fair here is to pick the document and sign and allow the professional nurses, the experienced nurses, to take care of the general public. But any other step by government to mitigate is just not fair, and we don't think it's the best.
All the way in May last year, a year on, this government has only been in power for about 5 months now. Why don't you give them time to settle, and then they would implement all of your agreements for you?
Yes, that is also another area. We had experience, okay? 2015, we negotiated in similar way under the same government or NDC government. And I remember Honorable Atu Forcing was the Deputy Minister of Finance then. That condition of service we concluded January 2016 has never been implemented till now. Okay, so we have given government January to this time. The question is, why are we not implementing it? Have they given any reason, you as the media, have you received any reason for which they cannot just implement this condition? Is it possible that with the dialogue and take your time and the dialogue, it is also going to end just like 2016? Is that possible?
On Monday, today is Thursday, tomorrow is Friday. By Monday, if you have not heard anything from the ministry, you will totally withdraw your services.
Exactly that.
Okay. Pastor Maybe we are most grateful for your time this morning, sir.
Thank you so much.